For years now, there have been calls to make the Office of Child and Family Services, currently part of the Department of Health and Human Services, its own agency.
The reason, critics say, is that children are getting lost in the system and too many of them are dying. There were rumblings about a decade ago, but it all came to a head in 2021 when 4 children who were in the DHHS system died at the hands of one of their parents. There was a hearing today about creating a single agency to protect children.
Our Pearl Small joins us live from the Capitol with more about what came out of that public hearing today. Hi, Pearl.
Hey, Amanda and Brian. So this idea has been floated several times over the last few years. And last year, a bill to do it actually passed through the Senate, but was tabled when it hit the House. So today's public hearing was a chance for the bill's supporters to renew their call to action and for the people who oppose the bill to express the concerns they have.
I'm here in support of the bill, LD 555.
Personal experience with Maine's Office of Family and Child Services is what brought Derek Levasseur to Tuesday's public hearing.
In my battle, it made it so that I was estranged from my son for months.
Levasseur, a father and independent candidate for governor, joined several other speakers who shared their stories and their belief that the overseeing agency, Maine's Department of Health and Human Services, has taken on too much and children are slipping through the cracks.
It's just so big. And we threw a lot more money at it. Taxpayers are carrying the burden of that, but yet the death rate in children is going up.
More children have died in Maine in the last 5 years than in 13 years combined. A statistic State Senator Jeff Timberlake brought up to showcase a growing problem and what he believes is an inability of DHHS to handle it internally.
We want people to have to answer to the people of the state of Maine.
His solution is a bill he's presented calling for DHHS to relinquish all control of OFCS, making them separate agencies and giving the state more direct oversight over child welfare.
They're not doing their job because they're not being held accountable. We need to hold them accountable, and this will do that.
However, DHHS's legislative director, Abby Stivers, reminded the public of other agencies within DHHS that provide vital resources to children, like Maine Care and behavioral health services. Stivers says this would divide those efforts, add more red tape without positively impacting child welfare.
Creating a separate department would require significant additional resources while providing less cohesive support to children and families.
Others who spoke brought up concerns about whether this is actually the right focus to fix the agency's problems.
So the reason I'm not for this is if we just move it into another department, then you have different letterhead. We have to have a cohesive and coordinated plan to be able to, what should the strategic plan for children be?
But many of those speaking up were in agreement that there is a crisis and some sort of change needs to happen.
But these are Maine families, and it's not a political separation. It's really just Maine families. We need to fight for Maine families.
Senator Timberlake brought up 6 other states that have already made the change, and after the hearing, the committee expressed interest in looking at what the effects of that had on those states to kind of see what the impact might be here in Maine. Brian and Amanda.
Pearl Small live at the State House tonight. Pearl, thank you.